Welcome back. I'd like to welcome my guest, Jack Jones. He's with PT Solutions Physical Therapy. Jack is the physical therapist and clinical director. So welcome, Jack.
Thank you. Thank you for having me.
Tell me a little bit about what sets PT Solutions apart from other physical therapy.
PT Solutions is really dedicated to exceeding the expectations of the patient. We have therapists with the highest degrees. We're doctors of physical therapy. And then a lot of our clinicians, or most of our clinicians, are board certified specialists, whether it be in orthopedics or neurology, whatever the case may be.
Great. And what kind of services do you offer to your patients?
So we really focus on physical therapy, but we do also offer speech therapy and occupational therapy. Additionally, we have just very outstanding personal trainer that works with us, who really helps in the discharge of patients, continuing that wellness. And then we offer endurance training for triathletes or people who want to run a marathon, something of that nature.
Wonderful, wonderful. Is Naperville your only location?
It is not. We've actually got locations in Woodridge, in Bolingbrook, Glen Oaks. I'm sure I'm forgetting people, and I apologize. But we'll be expanding in the near future, probably into the Romeoville and Wheaton areas.
Great. So you guys are growing.
Oh, in Plainfield. We have
Plainfield.
Yeah.
Super. So how can patients be seen if they want to come to PT Solutions?
The traditional route is really to have your doctor refer you to physical therapy, but that's not the only route. We do a lot of community events where we're out at 5Ks and what have you, and we'll do basically a free injury screening. And so that can happen in the community or in our clinic. If I have back pain, it's killing me, I can't get into my doctor, come see Jack. Oh, this is what I think's going on. Yes, you should talk to your doctor about coming to physical therapy, or that might not be appropriate. See your doctor. That might be more appropriate to have X-ray or MRI or whatever the case may be.
Right. Well, with all the summer activities, runs, and athletics, I'm sure you guys are...
It's heating up. Everybody's getting on their bikes, and the running clubs are meeting, so there'll be those tendinitis and I just got off the couch injuries. So we're ready for them.
After a long winter, we got off the couch. So what type of patients or diagnoses do you treat?
Typically, it's the orthopedic, neck, back pain is our most common, but we certainly see a variety of others. Personally, I see a lot of vestibular, meaning dizziness, vertigo patients, and kind of retraining our inner ear and our balance system, which is very debilitating for anybody who's ever had that. They're aware. But neurological conditions, post-stroke, those kind of things. So not just limited to neck or back or knee pain.
Okay, not the usual suspects.
Right.
And as far as insurance, do you all accept insurance?
We actually are able to see just about everybody. So the commercial insurance of Blue Cross, Blue Shield, those typical, also Medicaid, Medicare, and there's just a very few select, maybe an HMO. We had one the other day from Michigan that I'd never heard of, but unfortunately, we had to refer them to another provider. But just about everybody can be seen, including the Medicaid and Medicare.
Great. How many therapists are in your office?
Actually, it's just me right now. We've opened just a few weeks ago. So, if you come, I'm going to see you. And that's really the way we like it.
Yeah.
As we grow, we will expand and hopefully hire another therapist, but we're not really interested in having 14 people in the clinic and the aide or the tech directing exercise. We want it to be we're the skilled provider, and we want to be there to direct your care.
Fantastic. Do most of the PT Solutions in the other areas work the same way, that it's more of a smaller scale?
Definitely. It's we'll have the staff appropriate for whatever our patient load is.
Sure.
But we don't want to be hands-off. We want to be in the action, telling you what it is and why you should be doing this, and really have an interactive care, not typing my notes in the corner while you ride the bike.
Yeah, great. Is there like a real common injury or a therapy that you treat?
Back pain, low back pain is our most common diagnosis. So I would say that is...
Makes me want to sit on side chairs.
we can talk about posture, but back and neck pain are certainly the most common. After that, it goes knees and shoulders, more orthopedic issues, but generally it's spine issues.
Okay, interesting. We know that you've recently joined the Chamber, and what compelled you to join the Chamber?
Really being new to the area, personally being new, just haven't been here a few months, but also our clinic just getting started at the beginning of March and really getting a foothold in the community. So there's tons of partnerships and networking to be out there, and we don't know a lot of people. So, it's easy enough to go door to door and meet your neighbor, but
Right.
to be in the chamber, everybody's there for the same purpose of seeing who's who and networking.
Yeah, fantastic. Well, welcome.
Thank
We're
you.
happy to have you. I know that we were discussing before we started that you just moved up here from Florida, and so quite a contrast. PT Solutions is in Florida, so they moved into Illinois, and do they just find that it's a really ripe area for growth, or was there a need for something like what you guys brought?
That is part of it, and also our partnership based out of Atlanta with the Adventist Health System is really part of that as well. We have a great working relationship of basically providing great rehab care, something that we specialize in and something that maybe they didn't, and that kind of developed from there. So brought that to Chicago, and going to do the same thing.
Great. Is there anything about physical therapy, maybe a myth or something that people don't know about physical therapy and its value? Or
I would say the biggest myth that we deal with is that it has to hurt.
Oh.
People think of, certainly I had a knee replacement and they made me bend my knee, and those days are really gone. We're not jumping up and down on somebody's leg or arm and trying to bend it like a pretzel. Those days are gone. It's about restoring function and making you able to do what you need to do in a day-to-day aspect. And if you can't walk out of my clinic, then you can't do what you need to do. So we're not there to make you hurt. We're there to make you better.
Have you really seen, since you've been a physical therapist, things change a lot, or?
I have. The biggest change in our profession has been, in the past, physical therapy was, somebody does one thing, somebody else does another. The profession has really worked hard on research and saying, this is the standard of care, this is what's appropriate, this was what works best. So that is, if you have knee surgery, the approach is going to be the same from one doctor to the other with small variation.
Sure.
So the same should be true in physical therapy. While everyone's problems are different, there's back pain, and this is what it is, and this is how we should treat it, and the research supports that.
Wonderful, wonderful. Well, Jack, thanks so much for joining us today in PT Solutions, and we will be right back.